right, welcome everyone to the V3 implementation call. Today is May 11th. We're happy to have you with us today. Just as a reminder, these calls are recorded and they are offered on our website and also on our YouTube channel. If you need to review later or share them with somebody on your team that missed the call, or if there's a section that you want to just look at again, you're welcome to go back and view or share those as needed. We do consider these calls conversations. Please be willing to unmute or use the chat if you've got a question, comment, concern during one of the topics that are brought up throughout the agenda, or at the end of the meeting during open forum. Sometimes we get some really great questions from states or vendors that other experts like yourselves are able to answer and get some clarity. So these meetings are very helpful for those types of things as well. I'm going to pull up the agenda. I'll start with the maintenance update. Please excuse Jen Correa. She's out at a vendor conference this week, so I'm going to fill in for her on the maintenance update. We will be doing maintenance on May 17th and 18th. That is the normal maintenance window, and they're implementing some critical Microsoft patches. So they will be using that maintenance window this month. You will get notification in the Google group of any services that will be down during that maintenance window. And then as always, feel free to reach out if you've got questions or if you're getting some weird errors from submissions, anything like that, just let us know and we're happy to help you through that. Let me put in the chat the link to the website. We keep the maintenance schedule on the website so that you're just able to plan for that. So in case you have anything going on with submissions, you're aware of what's going on our end. All right, that's it for maintenance window. I'm going to go ahead and turn some time over to Ben Fisher. He's going to talk to us for just a minute about the 2021 Public Release Research Dataset. Ben, it's all you. Do we have Ben? Oh, all right. We're going to come back to Ben. And then Ben will tell us in a little bit about the cool 2021 public research data set. Lauri, would you be willing to introduce our guest this morning? We'll have Lauri introduce her, and then we'll move to that point in the agenda.
Yeah, absolutely. Yeah, I'm happy to introduce new state data manager from Vermont, Beth Brouard, and we are excited to have her today. She just had a project she was assigned in her state to research about psychological safety and specifically sexual harassment among EMS providers. And it was something she asked us if we knew if there were any other states that were looking into data around that or addressing the issue with training. And we weren't sure, so we wanted to give her a few minutes to share what she's researching and to have a conversation if there's any other states that are looking at this as well. Beth, are you with us today?
I am. Hello. It's nice to meet everybody, so to speak. As Lauri mentioned, I am very new, so I don't know really much of anything, but I'm learning. Lauri mentioned that something that's come up recently for us here in Vermont is psychological safety within the EMS workplace. We sent out a survey at the end of last year asking EMS providers within the state some questions about their experiences within EMS. And in that survey, one of the questions that was posed was, is there anything that's currently wrong with Vermont EMS? I'm paraphrasing a little bit here. And we only got about 10% of the respondents who actually made some sort of comment about what was currently wrong. But of those people who did respond to the question, 90% had some kind of comment related to psychological safety within the workplace. So that that included things such as bullying, hazing, sexual harassment. One comment mentioned sexual assault, unfortunately. The remaining 10% were split into two groups. One had to do with more administrative stuff, things like not enough coworkers, not enough pay, and then I believe it was 4% of the remaining people who put in something in as a response to that question mentioned that they didn't want to disclose as it would identify them. So that kind of really brought to the forefront of our attention the fact that there is an issue with psychological safety within at least Vermont EMS. In looking at those respondents, the ones who mentioned something about psychological safety, that 90% group, we found that about 84 had to do with gender inequity, sexual harassment, again, that whole sexual assault thing. So with that, we're really diving into how we can change this, how we can change the culture, how we can address this, and how we can move forward in a way that is more psychologically safe for all of our providers, because nobody should have to go through any of this when they're in the workplace. That being said, I didn't know if anybody else has faced this in the past, is currently facing this, has thoughts or suggestions, things that have worked for them, maybe things that haven't worked and to avoid. But just kind of curious, since I am new, if anybody had words of wisdom or anything that they would like to share or for guidance as I try to navigate addressing this. Silence.
Beth, I've got a question for you. Are you looking for it from a state perspective or from an agency or both? Could you describe how wide you want to cast the net?
So I guess I'm not really sure I understand the question. I'm sorry. Are you saying, do I want to address this for the entire state, or do I want to address this for a specific agency, or? From
feedback from other participants on the call. So are you looking for examples of states that have addressed this, or other research projects, other maybe efforts or projects that have gone into trying to determine what may be happening or how to address it?
All, to be honest, everything. Okay. I'm very much at the beginning of this, and everything. It's definitely a very large topic, and something that I personally feel is heavily contributing to our issues of retention. So everything, anything that could possibly help. I am all ears and would absolutely love to chat with anybody about. And if there are no comments or suggestions at this point, then that's fine too. At least now people know that there's at least one state out there that is facing this as an issue and is hoping to address it. So,
okay. Would you put your contact information in the chat?
Absolutely.
I was going to suggest that as well.
Yeah. Give me 1 second. I haven't memorized my work cell yet. So, but yes, I can absolutely do that. Got to look it up real quick.
Beth, this is Kelly from Image Trend.
Hi.
Hello. We can get you in contact with Morgan Anderson here. She works with a lot of those kind of research projects and just evaluating some of the data that you're talking about. So I'll get you in contact with Morgan, and I think she will have some really helpful resources to help you.
Awesome. Thank you.
You're welcome.
All right, it looks like there's a question in chat, but I'm not, AJ, if you're willing to come off of mute, I'm not sure if you mean this question linking social vulnerability index to EMS service area. if you're mentioning that particularly applying to this topic or just as a general question.
It could be linked. It could be linked to this topic. Basically, if she's doing the survey and knows the agency catchment area, she could look at geospatial temporal linkage between even types of calls, like if agency is getting like a lot of, for example, like gun violence, opioid calls, or different types of calls that might trigger, worse environments. So maybe we need to, like, for example, for opioid calls, we provide training for PPE and other services. Can we also include additional training based on the calls these techs are getting? So that was just a comment. Our method, ONC published our method, part of their PCOR efforts. I'll paste the link to our method that we're using in the state of Illinois. And if that's helpful, you could contact me offline.
Okay, thank you. Just so I'm clear, because I think I'm a little bit confused. I've only had 1 cup of coffee instead of my normal 16. Is this more of issues of psychological safety with providers interacting with patients, or providers interacting with providers?
This could be providers interacting with patients, and can you run like an ML model if this provider in this area is getting a lot of these types of calls for the patients, is this provider being affected too?
Okay. Yeah, that would be interesting. Something that I know most of my focus has been providers and providers, but something that I didn't think about until you just brought this up is potentially the interaction between providers and patients then influencing and leading to provider and provider issues. So that would be very fascinating, and I can definitely see a lot of value in this. Thank you.
And it looks like Kaylin's got she did a paper on this. And Kaylin, we're probably all interested too. So if you're willing to share far and wide, we'd love to see it. And just as another thought, Beth, a lot of clinicians serve the communities that they live in. So the social vulnerability index may be very applicable based on the community that the provider lives in.
Excellent point. And yes, I hadn't thought of that, but yes. Oh, I'm so excited. I've got so many resources. Thank you.
We have a really talented and experienced group on this call. So it's a great audience for these questions.
Absolutely. Well, I can't think of anything else. So thank you guys. I'm very excited.
Thank you, Beth. And we're excited to have you as the new Vermont data manager. It's a lot of work. Data managers have a lot on their plate.
Yes.
All right. If everyone's okay, we'll keep moving along in the agenda. I'm going to go ahead and toss it back over to Ben. And we just were warming you up, getting you guys excited, that anticipation of how cool the 2021 research data set's going to be. And now Ben's going to do the big reveal. Right, Ben? It was all
Julianne, you're
anticipatory.
You're like my hype guy. You got everybody all ready to go. This is really exciting. So the 2021 public release data set, research data set, is now available. It is almost 49 million EMS activations in about 14,000 EMS agencies across 53 states and territories. So quite large. We're getting closer and closer to a census of EMS agencies across the country. It is available from our research request page. So there's a URL at the bottom of this flyer, and then there's a header on our on our main website, and it will take you to the requests page. There's a little bit more information about the 2021 data set if you're interested in reading more about it. And then you fill out an online form that gets routed to me, and we're turning them around fairly quickly. You'll receive that one by FedEx. If you have any questions, please reach out to us. We're happy to talk about it. And yeah, we look forward to providing it to you all, because you all are the ones who make this all happen.
Any questions for Ben on the research data set? All right, very cool. Thank you all for working so hard to get 2021 data submitted, and being able to add such robust data for researchers and national, state, local people to be able to utilize that EMS data that our EMS field clinicians work so hard to collect. Thank you so much. Next on our agenda, I'm going to turn some time over to Monet. She's going to talk to us for a minute about the annual meeting.
Can you hear me?
Yep, I can hear you.
All right, fantastic. Greetings, everyone. Before I talk about the annual meeting, I actually want to let you know that we are excited to inform you of that we are celebrating a historic moment in the NHTSA history. On the NHTSA homepage, you'll see this lovely map, and it's all green. And we're decked out today in green. If the NHTSA TAC team would like to turn on your cameras and, let everyone see you, we are celebrating for the first time since the NHTSA TAC started collecting data back in 2006. We're now collecting data from all 50 contiguous states and 3 territories. We are celebrating and we appreciate the dedication and the hard work of all the state EMS data managers, the EMS directors, and certainly the EMS software development community. The NHTSA TAC, again, we're decked out in green because we're celebrating with you, but we also want to express our sincere appreciation to all of you on the call for all the hard work that you do. So we just want to say thank you so very much. And this is just exciting. So, and I don't want to pass this time without allowing Dr. Mann to say a few words. I believe he's also on the call today.
Oh, thank you, Monet. And I apologize, I'm offsite attending a conference, but I'm sitting here with Eric Chaney, and we're both listening to the presentation here, and just incredibly proud of all the hard work of the folks on this call, those past and those present who have worked so hard to make this happen. This is the first time in 18 years that this map has been completely green, whether it was version 2 or version 3. This is the first time. And it's an incredibly important time for us because I think Eric is working incredibly hard ensuring that the power of NHTSA is recognized here after the pandemic, and to be able to show something like this, that we have a direct view into community health through our EMS systems across the country is just overwhelming. Eric, computer microphone isn't working. He shares his gratitude for everyone as well. Yeah, and just thank you. This is an incredibly important time for us. So thank you, everyone.
Hey, Clay, it's Mark Roberts. I wanted to say also that congratulations. This is really great work. Given that California, was the first state to be version 3, are you going to have a separate map that shows the version numbers maybe so we can see who's trying to move towards 3.5, or is there any thought about that? So that would help too. And there it is. Yep. It is.
It's it's there. And of course, we'll start down the progress of going green there.
Exactly. Exciting. All right. Well, great. Well, enjoy your conference, and thank you guys for all your hard work.
Yeah. Thank you, Mark. And thank everyone for just keeping us on our toes, us all working together. Wow. Just This isn't present in any other part of healthcare in this country. We work well together as an industry, and it's just it's a great thing to see. Thank you, Monet.
Thank you, Clay. All right, and Mark, that is a fantastic question that you asked about the 3-5 map. We'll add that to the agenda for next month so that we can, or the next call, and we'll talk a little bit about progressing on the 3-5 map. Okay, now I'm going to go back to the top of this banner, the hero banner here, where you see all these lovely pictures. I'm going to go ahead and click on the save the date link here. You'll see that we currently have the letter that we are inviting you to the annual meeting. We did have an opportunity to send this out directly to state managers as well as the software vendor community. We are eagerly waiting for you to join us, and we would love for you to go ahead and get registered. The link to the registration is right here at the red banner, red button. And you'll see here that you can register for the in-person meeting. That's the link here on this left-hand side. And then we have a registration for virtual attendees because I do understand that some of you would like to stay home in the comfort of your workspace there and attend the meeting. There is a small fee required for the virtual registration. And then we also would like to point your attention to the Deer Valley Resort reservation as well, so that you can get your rooms booked, and we'll also be able to review this information so that I can start the catering menu and also the number of attendees. So I encourage you to get registered as soon as possible, because we would like to keep all 75 rooms that we have allocated for our participants. And if you have any questions, please do not hesitate to reach out. My email address link is here, and I will be able to help you if you have any issues with this registration site, or if you have any questions about the lodges or need special accommodations. I would like to ask if there are any questions at this time. Okay, if you have any questions come up later, please send them to us directly, and we'll be happy to get back to you as soon as possible. Thank you so much for your time, and I'll turn it back to you, Julianne.
All right, thank you, Monet. Next on our agenda, we've got an ET3 update with John Beckett. John, did you want to share your screen?
Yes, Julianne, if you could, I would like to do that.
Yep.
Thank you very much. All right, thank you. So just a few updates. Some of them you all are familiar with from prior updates. I just wanted to give you some numbers to start out with. So we are active in terms of our data submission now. It's been about 1.5 years that the program has been up and running. And so we do have quite a bit of records that we've consumed. We're approaching about 13 million now. And that's something that we, again, have had a lot of work behind in terms of not only efforts from the vendors and the participants, as well as our internal data staff. So we are, again, very happy that we're able to get to this point. In terms of some things happening in the future, we are planning our next testing cycle for 3.5. And again, I just saw the nice map that Clay introduced us to, and it looks like a lot of the states have not turned to green as of yet. So we may be ahead of the curve here a little bit on our offerings, but I did want to just point out we do have possible dates that we could conduct testing that go into August. So right now, June 1st through June 17th is one test cycle, and then another one is July 11th through the 5th. I think we have a couple of participant vendors who are holding out the passing of their data until we are certified with 3.5. So I just want to let you know we are there. And if we can get you through the testing cycle, that would be great. We do have one vendor that has gone through. Again, we have exercised our internal process for that. Other things coming up, we have a webinar that is coming up called The Effective Use of Data. And this is, again, not so much looking at data submission, but rather how that data that is being submitted to us is going to be used in terms of getting the ET3 goals, as well as some of the goals of the EMS agencies achieved. So this is a really important one where we'll talk a lot about measures and metrics and things like that. And it's just to educate and get folks, looking at their data and seeing exactly whether or not they might be achieving some of the goals that they've set. So that's on May 18th from 1 p.m. to 2 p.m. So again, I encourage you to participate in that. The other announcement here is that we've successfully now delivered 2 months worth of dashboard reports. And some of you may have seen those reports. We have a number of metrics in them. We have run charts. And again, it's something that gives feedback to the participants about what ET3 program is seeing in some of their data. So that's important. And then again, we have participants that are successfully implementing not only with ePCR submissions, but also claims. Keep in mind, those are 2 areas that are equally important to, again, really crystallize the activity that's taking place with the patients in the field, and then the proper use of the custom fields, the ET3 custom fields, which are part of the ePCR record. So just want to point that out as well. Just a couple of things on the monthly dashboard report. For some of you that may not have seen it, we are interested in beneficiary engagement and consent. So that is covered in a couple of our metrics. We also have intervention utilization that we cover. Again, another set of metrics are developed to report on that. And then we also have claims and data submission metrics that we're reporting on the monthly dashboard report. So all of that is, again, an important first step to getting feedback. And the goal here is to increase quality and to reduce the overall costs. So again, this is, another big step, I'd say, towards achieving that. Just real quick, as a refresher, it is visual in terms of run charts, and we have, also some tables in there to support them. But we are looking at the participants' performance in terms of implementing transport to an alternative destination, TAD, as well as treatment in place, which are TIP-related interventions. So those are 2 that we are monitoring. That report is emailed out every month right now by the project officer. Every participant has a ET3 project officer, and it does provide useful data to increase the likelihood of participants successfully achieving model aims. And I mentioned those earlier, increasing quality and reducing costs. And these metrics are tied to the primary and secondary drivers that are part of the ET3 model diagram. So those of you that may not have seen that diagram, I can certainly share that with you at some point if you let me know. So I can definitely reach out and let you know what that looks like. Just finally wanted to mention dropped records. We are, making sure all of the participants' data is being received as well as represented on these reports. So we are monitoring when we have issues like drop records, and they tend to fall into the category of not having the accurate D-agency field values. And so some cases, maybe the D-agency 01 has changed, or D-agency 02 has changed, and we need to be in sync with that. So until we get in sync with those, we end up not consuming them, and they're considered to be dropped. We have decided that we are going to take steps to consume those records if we know who that participant that sent us those records, as opposed to reaching back out to vendors. So that's good news. We're not going to be sending out emails, asking for resubmissions or anything like that. So that's an important thing. And just so you know, in terms of tracking those submissions, we are also now looking at any custom field values that might be missing. So as you can imagine, when we get claims submitted, but there's no entries in the EPCR record, there's some inconsistency as to what occurred on that incident. So that is something that we are tracking, and we want to make sure we get the data accurate. All right, any questions or comments on what I've covered? All right. Thank you very much. And Julianne, I'll turn it back over to you.
All right. Thank you, John.
Yeah.
Let me pull up the agenda again. We have a last minute addition. I just wanted to have Lauri Bradt talk for just a minute about State 3.5 transition plans. We've had some updated information shared on that. Lauri, would you like to talk about that for a few minutes?
Sure. Thanks, Julianne.
Thanks.
We did. I want to thank everyone who responded to my last minute emails and phone calls in the last few days. We had a request to give an update to the CDC of when states plan to make the transition to version 3.5. And so we had heard that some of your dates had changed, and thank you to everyone who confirmed that if I reached out to you. And I just want to remind you, if your plans continue to change, just keep us updated. If you plan, whatever your plan was, gets extended or moved up faster. I know some of you that I spoke with are maybe in staff transitions among your state or software vendor transitions, and you just don't know yet. So there are some states we know are still TBD. And if you can let us know once you know. I also want to report that of the states we've heard from, there are 25 states that are planning to make this transition before the end of 2022 in this calendar year. So several of you are working on that currently, and we want to thank you for that. And just remind you that we are here. We're a resource if you have questions along the way. We're happy to help you with that if you can reach out. I will post in the chat in just a moment a link to our version 3.5 revision page with some resources. And this will be updated today or tomorrow with the new state and vendor transition plans that we've heard over the last few days. And then we also will go through and update your state pages with your transition date if that has changed as well. That's all I have. Let me know if you have questions, or thank you for continuing to keep us updated.
Thank you, Lauri.
Yeah.
Any questions for Lauri? All right. Next on our agenda, items from the Office of EMS. I don't know if Eric was able to connect with a working microphone. Eric, are you with us by chance?
Eric is sitting next to me. We're listening to the call, but he has no issues from the Office of EMS. Thank you, Julianne.
Okay, thank you. Any questions, concerns, comments to bring before this group in upcoming I'm reading two lines together, in open forum. Any questions, comments, issues? You're welcome to unmute and bring them to this group. All right. Our next V3 implementation meeting will be May 25th, same time, same place. We keep these on the second and fourth Wednesdays of the month. Please let us know if you have topics, questions, concerns that you want brought before this group. We have a really terrific representation of a lot of skill sets. We appreciate you being with us and sharing your skills and experience with each other. If you have any questions or concerns, please feel free to reach out to any member of the NHTSA TAC or to Eric Chaney. We appreciate your participation. Thank you for being with us today, and I hope everybody has a safe and productive rest of the day. Thank you all.